So I have several pointers for using continuous rate infusion pain medications for cats. Continuous rate infusion is a very effective strategy for providing intra and post-operative pain control in both cats and dogs. But in cats, it's particularly important for us to be particularly careful so that we make sure that we minimize our risk for medical error. My first pointer is that once we figure out the dose that we're going to use by looking at the formulary, that we actually create Excel spreadsheets with dosing using a standard dilution of the pain medications that we use for continuous rate infusion so that we don't have to calculate a new set of medications, a new set of dosings, and a new set of flow rates for each and every patient. By having a standard dilution for which we reach for our CRI medications and having that standard dilution pre-calculated based on body weight, we minimize our risk for medical error by just being able to reach for that flow rate for that patient. What we know about human nature is if we don't make something easy, it won't get done. So pre-calculating those doses and having them on an Excel spreadsheet pre-printed and in a notebook in the treatment area makes making CRI a very easy, almost an everyday occurrence in practice. In addition, we have to know how to make those standard dilutions. So we have a separate Word document that we have pre-printed that helps my team know how to make those standard dilutions and make them quickly as we are preparing for a particular feline patient to have CRI medication. This isn't really too much different from what we do in dogs, but cats have their own needs. Which medications we use will depend on the patient, but typically we reach for both fentanyl and ketamine continuous rate infusion at very specific doses calculated for each individual cat, in addition to the intravenous fluids that we use during anesthesia. The one additional drug that I will sometimes use for continuous rate infusion in cats that isn't a pain medication is metoclopramide, and I will use this in kitties who are having issues with their GI tract or in the post-operative setting if we have some post-op ileus. By doing a continuous rate infusion versus pulse dosing, I'm able to provide a lower dose at each delivery because it's delivered continuously, and I'm able to produce a much more sustained response and result. Frankly, we love using continuous rate infusion in cats.